Hello friends, let's discuss about the most important topic in pathophysiology of hypertension. In the previous video, we had discussed about peripheral autoregulatory component, which is very important to maintain the blood flow as well as blood pressure in the capillaries as well as arterioles and venules. Along with humoral and neuronal regulation of blood pressure, peripheral autoregulatory mechanism will also play a crucial role in maintenance of blood pressure, which we have seen in our previous video. Today, we will discuss about vascular endothelial dysfunction, which is very important in understanding the pathophysiology of hypertension, where because of the endothelial damage, there is a disturbance between certain vasodilatory as well as vasoconstrictory component which is released from the endothelial cells of vascular smooth muscle. So let us discuss first what is the normal role of vascular endothelial in maintenance of vascular tone and blood pressure. So basically vascular smooth muscle are present in the blood vessel which is carrying the blood, whether it is artery or vein. So this vascular smooth muscle are maintaining blood vessel tone and thus maintaining the blood pressure. So now most important concept of vascular smooth muscle and how they are maintaining blood vessel tone is very important for us to understand in order to understand how regulation of blood pressure takes place in the artery as well as vein, which is composed of vascular smooth muscle. So let's say for example, this is a artery where I have shown that artery is composed of certain layers. There are three layers in which this is the endothelial cell. So this endothelial cell are present which is directly exposed to the blood which is flowing inside the artery. This endothelial cell, beneath that endothelial cell, there is an internal elastic membrane which is responsible for contraction and relaxation mediated via vascular smooth muscle. So when the vascular smooth muscle contracts, there will be contraction of this blood vessel. When this vascular smooth muscle relax, there will be narrowing of this particular lumen and thus this artery lumen diameter will increase. So that will be maintained by internal as well as external elastic membrane. In between internal and external elastic membrane, there is a smooth muscle which is responsible for either contraction or relaxation. Now, when the blood is flowing, when this blood is flowing continuously through artery and vein, sometimes there is an increase in blood flow in the artery. Increase in blood flow in the artery leads to generation of shear stress. This shear stress, which is generated because of the high flow of blood inside the lumen of artery, stimulate this endothelial cell to release certain substances in the blood or in this particular local area. This endothelial is then, if I zoom this part over here, when there is a high shear stress, there will be release of nitric oxide synthase. This nitric oxide synthase is released in response to the shear stress generated inside the lumen of artery, will convert L-arginine, which is already present inside the endothelial cell and smooth muscle. This L-arginine will be converted with the help of nitric oxide synthase to nitric oxide. Now let me explain. This nitric oxide synthase has three different subtypes. The first subtype, nitric oxide synthase 1, is present in the nervous system. Second, nitric oxide synthase 2 is present in the immune cells. And third, nitric oxide synthase is present in the endothelial cell. Apart from shear stress, this nitric oxide synthase is also stimulated and activated by the acetylcholine and bradykinin, which is also responsible for vasodilatory effect through release or synthesis of nitric oxide in the endothelial cell. So here from L-arginine in the presence of nitric oxide synthase. Now we have understood that this is an endothelial cell. This is an endothelial cell. So nitric oxide synthase 3 is present over here, which will convert L-arginine into nitric oxide. This nitric oxide will generate or synthesize in this vascular smooth muscle, will penetrate to the smooth muscle which is present beneath the endothelial cell, separated by internal elastic membrane. Now this nitric oxide will be transferred to smooth muscle, and here this nitric oxide will activate guanylyl cyclase. This guanylyl cyclase, when stimulated or activated through nitric oxide, will convert GTP into cyclic GMP, guanylyl triphosphate to guanylyl monophosphate, and the level of cyclic GMP in the smooth muscle will increase. Now this high level of cyclic GMP is responsible for inhibition of actin-myosin mediated contraction, and thus this will do relaxation, and relaxation of vascular smooth muscle. Specifically we say vascular smooth muscle because smooth muscle which is present in the blood vessel. So this smooth muscle will then dilated. So dilation of, or we can say vasodilation in the artery or vein, will try to reduce this shear stress. This is a very important compensatory mechanism via healthy vascular cells which is present, or vascular smooth muscle which is present inside the artery and vein, will try to generate nitric oxide in response to the shear stress generated inside the blood vessel to decrease the to relax the smooth muscle and to increase the diameter of artery or vein, and to prevent damage because of shear stress. So this is how nitric oxide will be synthesized by the endothelial cell. Now let us understand that when there is a high pressure, ultra high pressure inside the artery or vein, which lead to certain damage of endothelial cell. When these endothelial cells got damaged completely, it cannot synthesize nitric oxide, and nitric oxide is a potent vasodilator which will be responsible for the relaxation of smooth muscle and dilation of the artery as well as vein. So if the pressure is very high, because endothelial cells are directly exposed to the flow or force which is coming inside the artery or vein, it will damage the endothelial cell, and because of the damaging of this endothelial cell, there will be no synthesis of nitric oxide, there will be no vasodilation which is mediated through nitric oxide, and because of that there will be certain other things will start occurring inside the blood vessel. First is, when there is less vasodilation because of the damage in the vascular, specifically to the endothelial cell which is present in the vascular region of artery, it try to, because of the damage, it will release thromboxane A2. Now this thromboxane A2 is synthesized from the platelet, and this platelet when secretes thromboxane A2, because there is a damage, so there is a high chance of internal bleeding. In order to prevent the bleeding, there should be some clotting factor. Thromboxane A2 will be doing vasoconstriction in order to prevent the blood loss and to maintain the blood flow. This is again a homeostasis mechanism, because when there is a bleeding, there will be a high blood loss. High blood loss lead to decrease in the blood flow because of decrease in the blood volume. So to maintain the blood flow and maintain the blood volume, whenever there is an injury, there will be release of thromboxane A2 from the platelet, and this thromboxane A2 will do vasoconstriction. So in the absence of nitric oxide, where there is no vasodilation but there is additional vasoconstriction because of thromboxane A2, and this is how the vasodilatory component, when stop acting, vasoconstrictory component will be activated, and it leads to vasoconstriction in the vascular smooth muscle, which will be responsible for high blood pressure. That is one fundamental concept when there is a disturbance or vascular endothelial mechanism got dysfunction because of the damage in the endothelial cell. Second important factor over here is when there is an inheritatory damage in the endothelial cell or activation of nitric oxide synthesis. If the nitric oxide synthesis will not be generated, there will be no conversion of L-arginine to nitric oxide because of hereditary deficiency of nitric oxide synthesis in the human body. So that will be the again responsible factor for not releasing or synthesizing nitric oxide, not reaching to smooth muscle, not causing relaxation of smooth muscle and increasing the diameter. Now there are certain other component inside the vascular smooth muscle like endothelin. So endothelin 1 is known as potent vasoconstrictor. It is a potent vasoconstrictor because in certain case when there is a depletion of blood volume, there need to maintenance of blood flow inside the vital organ where endothelin 1 will do vasoconstriction and try to push the blood inside the vital organ. So one of the important component is endothelin 1. Now let us understand how endothelin 1 works. So this endothelin 1 first synthesized from the prohormone with the help of endothelin converting enzyme to endothelin. Now this endothelin is having three subtypes: endothelin 1, endothelin 2 and endothelin 3. But endothelin 1 precisely present inside the vascular smooth muscle, whereas endothelin 2 and 3 are present in the interstitial epithelial cell, which is not responsible for regulation of vascular blood vessel tone or blood pressure. So we are not discussing it, but endothelin 1 which is present inside the vascular smooth muscle, we will be discussing endothelin 1. Endothelin 1 when released, it will bind to the endothelin 1A and endothelin B receptor. See, there are two type of receptor for endothelin 1. Endothelin 1 can also bind to endothelin A receptor which is present in the vascular smooth muscle, and endothelin B receptor which is present also in the different parts like urinary bladder as well as interstitial or intestine of a human body. So for us, endothelin 1 binding to the endothelin A receptor of vascular smooth muscle will be responsible for potent vasoconstrictory action. It will constrict the vein as well as artery. It will decrease the diameter of artery and thus it will try to maintain the blood inside the vital organs when there is a depletion of blood volume. So that is a function of endothelin 1. Now this nitric oxide is a potent vasodilator and endothelin 1 is a potent vasoconstrictor. Both the activity inside the vascular smooth muscle will balance the blood pressure and blood flow in different situations like overloading of blood volume or depletion of blood volume, and thus this vascular endothelial mechanism is helping to maintain or regulate the blood pressure. But as I said, when there is a deficiency of nitric oxide because of the any of the mechanism where there is a damage in the endothelial cell or when there is a deficiency of nitric oxide synthesis in the human body, there will be no synthesis of nitric oxide. So potent vasodilatory action will be lost. In that condition, there is a disturbance between vasoconstriction and vasodilatory effect and the blood pressure will rise. Second, when there is an excessive synthesis of endothelin 1 which is having potent vasoconstrictory action, constrict the artery as well as vein and cannot be compensated by the vasodilatory effect of nitric oxide, which lead to persistent elevation in blood pressure. So this is a most crucial factors inside the vascular endothelial dysfunction component of pathophysiology of hypertension. Along with this, there are two different vasodilatory as well as vasoconstrictory component. One is endothelin 1 which we have discussed. Second is angiotensin 2 and certain prostaglandins. And in case of vasodilatory, nitric oxide as well as bradykinin. So nitric oxide and bradykinin should be secreted in certain level, will be compensating the effect of endothelin 1 and angiotensin 2. Angiotensin 1, angiotensin 2 and the endothelin 1. These are responsible for vasoconstriction and nitric oxide and bradykinin is responsible for vasodilation. We are not discussing bradykinin and angiotensin 2 because we already had discussed this in renin, angiotensin, aldosterone system, and it is a part of humoral mechanism. Under the humoral mechanism, RAS is one of the component where bradykinin and angiotensin 2 mediated effect are already discussed. So we will be focusing majorly on nitric oxide as well as endothelin 1. And as I said, prostacyclins, which is a part of prostaglandin family, it is synthesized from the arachidonic acid, and arachidonic acid will be converting or synthesizing this prostacyclin, which is having vasodilatory effect. This vasodilatory effect will be compensated by thromboxane A2, which is having vasoconstrictor effect. So this is how there is a balance between vascular smooth muscle generated vasodilatory component as well as vasoconstrictory component. I hope you have understand the vascular endothelial dysfunction mechanism responsible for regulation of blood pressure if it is normal. When there is a dysfunction in vascular endothelial mechanism, it leads to elevation in blood pressure. Let's discuss the last component in the pathophysiology of hypertension, that is electrolyte imbalance. Now, in order to understand the hypertension, this is the least important concept in the pathophysiology of hypertension, that is electrolyte and how electrolyte disturbance will leading to rise in blood pressure. So we need to understand which is the important electrolyte in the human body, which will play a vital role in the maintenance of the integrity of a vascular smooth muscle tone and blood pressure. So we have sodium, calcium and potassium, where sodium and calcium is extracellular cation, whereas potassium is intracellular cation. These electrolytes are responsible for generation of action potential and mediated contraction as well as relaxation of vascular smooth muscle. So here let us discuss how sodium, calcium and potassium will play an essential role in maintenance of a normal integrity of blood vessel and blood pressure. Let's discuss sodium first. So by so many scientists, it is discovered that sodium elevation inside the human body is responsible for increase in vascular resistance, which is total peripheral resistance, and responsible for rise in blood pressure. How sodium level got increased inside the human body? One of the mechanism is natriuretic peptide deficiency. Natriuretic peptide or hormone, we had discussed already how natriuretic peptide and hormone works in maintenance or regulation of blood pressure via extracting sodium more through urinary system and water and decreasing blood volume, mediated control of blood pressure. When there is a excessive secretion, when there is excessively sodium retained inside the human body, intracellular sodium concentration increases, and this intracellular because of there is a imbalance between extracellular and intracellular sodium level, intracellular sodium concentration increases, and this intracellular sodium concentration when increases, it is responsible for generation of action potential, more action potential, and contraction of vascular smooth muscle, which will ultimately increase the vascular resistance, and this increase in vascular resistance is responsible for high blood pressure. Because of this reason, restriction of sodium in the diet is recommended by many cardiologists to control the blood pressure. It is not significantly reducing blood pressure, but it is reducing blood pressure in a minor level. Say for example 2 to 5 mmHg blood pressure gets down when the patient suffering from hypertension restrict the sodium intake via diet. Second is calcium. Calcium is very important component. If there is a dietary deficiency of a calcium, or if a person is having thyroid related problem, which is responsible, thyroid hormones are responsible for maintenance of calcium homeostasis as well as certain kidney related component. So if there is a disturbance in dietary calcium intake, in parathyroid or thyroid hormones, or in the renal components, there will be disturbance in the intra as well as extracellular calcium, and this disturbance will lead to increase in intracellular calcium because of the deficiency of calcium inside the human body, lead to again increase in vascular tone, because increase in intracellular calcium is responsible for contraction of vascular smooth muscle. Contraction will decrease the diameter of lumen, and diameter of lumen when decreases, it increases resistance, total peripheral resistance and blood pressure. And the last is potassium. Potassium depletion through any abnormality in urinary system or any other component, it leads to increase in vascular resistance like calcium and sodium is doing, and because of that it is increasing blood pressure. Potassium is very less studied, that how potassium depletion is responsible for blood pressure elevation, and thus we don't have exact mechanism how potassium depletion is responsible for high blood pressure. So that is all about electrolyte imbalance and how it is altering the normal homeostasis of regulation of blood pressure and causing persistent elevation in the blood pressure. Thank you so much for watching. I hope you have now understood all the important component inside the pathophysiology of hypertension, and you will be ready for the next component where we will be discussing about management of hypertension and physiology as well as pharmacology of all antihypertensive drugs. Thank you so much. Keep watching, keep learning, keep growing.